I could go on and be like, day, whatever it is. 21st day of April. It's a Tuesday, 7:05. Let's go over to the phones. Just trying to get more info about the community testing. Well, of course, we had Mayor Savares on, and one of the doctors on the Physicians Advisory Group, a regular to the show, Dr. Hoa Nguyen of American Medical Center. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Half a day.
So I guess first of all, I want to ask, what do you make of all of these zero positives? I mean, we make the joke every morning that, I bet you there's going to be zero positives tonight, and I've been right. I mean, we should start a pool or something, Bree.
Yeah, so far, we are doing good. At the clinic level, we see our census are going down on the patient come in with cough and cold on a symptom of COVID-19 for the past probably 10 days or so. But we should not let that let our guard down, because the Easter weekend just last weekend. So this coming Sunday is very crucial because it's 7 to 14 days out. So we keep our fingers crossed that the trend continue.
Doc, the governor and Linda had said in the press conference that people just aren't presenting themselves to be tested. How accurate is that?
That's might be the reality. A lot of people might be, listening to the message that we've been passed on, several weeks now, that if you have, cough and cold and the type of illness, to stay home and isolate themselves. And that's a high possibility. That's the reason why we see less patients in the clinic at this point, because people decide to stay home.
Right. So how many of these people you think are staying home that are really sick?
We still do a lot of phone triage, guys. The people, patient call in, and they ask advice on what to do when they have cough and cold, and so we basically advise them to stay home. So the phone message is still there. It's just that the visit, the clinic visit is down. So that's good. Mm-hmm. Like I say, this weekend is about 2 weeks out from the Easter weekend. So if the train are coming down, then I think that the island, we did the right thing. But again, we still need to keep our guard up rather than have a rebound like other places does.
Right, but I think that a lot of people are hearing this conversation and seeing that we continually get zero positives for COVID-19, and then they're also hearing the governor talk about reopening the island. So how do we kind of balance that conversation, which is taking up a big part of the landscape, and what a lot of you guys are saying is like, hey, let's not let our guard down, let's take this serious? Because it does seem a little bit of a mixed message.
Yeah, the other place in the state, they, so quite a few places are trying to open back up a little bit at a time. The governor have a hard decision to make, to open too early for owner business. You might see a rebound on the island, but I think sooner or later, the governor will have to open, but probably in piecemeal. I know she have an advisory committee to try to put a plan together for our island here, and I think the plan should be released to the public pretty soon. But like I say, it had to be planned and staged, and not everyone open at the same time. But we still have to practice, the social distance and use the mask and hand washing. That's a big key that we need to put out in public. We need to continue to do those things.
Doc, when we start to do this community testing, and I think the commitment, did the governor say they're going to test 250 some people a day?
According to Nestor's report, it said that it was going to start this week, and I think it was up to 100. I don't know if that was a day.
Doc, what did you hear, Doc?
Yeah, this is a reason thing. I mean, that's our ability to do the test. That's the number in the bone part. But are you going to swap, 250 per day? I don't think so. It's really, we have to not go out there and do mass testing, but kind of target testing certain social groups, certain area. It'd be much more effective, to go out and swap everybody in the street. It's not going to be effective. So I think the number is there. They just need to come up with a target group to go after, to isolate those target group and try to prevent it from spreading out throughout the community. So I think that's just a number that they put out, but I think there's more plan to who they're going to target to be tested.
Now, how do you determine who you're going to target to test? Who determines that? Public health or the mayors or?
No, the public health, they have a lot of data. I mean, we know that who's coming from, the Filipino, the Chamorro, the Micronesian. There's certain target group there, and where it's coming from, the cluster they identify in the past. So through the tracing and the contact and the tracking, they probably know which target group they're going to go after. So, and with the help of the mayor, and there's a lot of people put input in there, but like I say, it's a target group and not go out there and just have a drive-through and everyone testing.
Okay.
I don't think that's going to happen.
Okay, because that's kind of what the mayor made it sound like. They were going to have testing available, drive-through testing, and da-da-da. There's going to be one in the southern part of Guam. There's going to be one in Chigo,
right.
Manila, and more than likely on the weekend. And if you want to come and get tested, come on, drive through. That's kind of what it sounded like.
Yeah.
And it didn't seem like that was right.
And Doc, let me just read you a soundbite from, and this is a verbatim soundbite. Officials, well, it's from Nestor's story.
That's not the soundbite, that's the lead.
Okay, so they're expecting to be able to start conducting up to 250 tests a day, and more as the capacity increases. That's the info that we got from the press conference yesterday.
Yeah, but like I say, that's a capacity. But it doesn't mean you're going to swap that many people per day without having a valid reason, like I say, target testing. You just don't drive through, and that's a lot of paperwork, a lot of info you have to collect in order to identify who you swap and how you're going to contact them. So it's a lot of work. I know public health, some satellite clinics here, just like in Barrigada and someone else, but people can go there and request a testing, but a drive-through, just like in Cyclone, it is a nightmare, and I don't think they come up with a plan how to implement that one yet. So like I said, it's not a good idea to use the test as the test still kind of limited, a number increase from a few to 20, 40 to 200 plus. But like I say, it takes a lot of time, a lot of preparation, and a lot of protection for the healthcare worker to do the swapping. So it's going to be targeted. It's not going to be a mass testing.
Have you seen this plan, or is it still being written up?
We have a meeting tonight. And that's
right.
The thing that I will bring it up. We didn't have a meeting on Sunday, so tonight's the meeting, and that will be one of the questions we're going to bring it up with public health and try to, help them, come up with a plan to do this testing.
Right.
As like I say, as we have more test kits coming in, we have to use it in a way that it makes sense.
Doc, can we just set up something for tomorrow morning, maybe a debrief of the meeting tonight?
Yeah, I mean, we can try. I mean, like I said, nothing promising to you, but like I said, we're going to have a few more issues to work up with to advise the governor on moving forward. So, I mean, we give you a brief breakdown what's going on.
Yeah, appreciate it.
What about a new trajectory? Are we going to see that come out anytime this week or next week?
The trajectory we have is, like we said, we really follow the FEMA model. And like I say, that's just like anything else. It's a model, and we continue to do what we do. That means that we are doing very well. But like I say, times will tell the next few weeks or so to see if we are beating that model or this is temporary, low point, and then it might pick back up again. We don't know. So like I say, we do a very good job in social isolation and social distance and masks. So we have to push those points all the time now.
Mm-hmm.
Doc, I wanted to ask you, this is something we talked about last week, and we tried to ask it in the press conference yesterday, and it looked like Linda was starting to answer it, and it goes back to what we had discussed about deaths where they believe it could be COVID-related, they swab the body, it comes back negative for whatever reason, but that there's some type of clinical diagnosis on this. I'm just trying to like track this down. This is something we heard from some sources, and we had spoken to you on it, and you said that it was possible that we have had people die of COVID related issues, and that we're not counting it. And is there a way to go back and look at those and maybe get some numbers, or what are your thoughts on that?
Yeah, I know. What I know so far is that any type of DOA death arrival to the hospital, they test them all, and so far all the DOA is basically a negative for COVID-19. Okay, so any type of death, even in the hospital, they do test the patient, make sure they're not COVID-19, and so far I'm not aware of any. And people called yesterday and say, we heard there's 5. I told them, it's a rumor. There's no sense of public health or anyone trying to change those numbers, because those are reportable and by law. So, you cannot, kind of change the number and hide it. You have to report that. So when they say that clinically COVID positive, mean that the test is negative, but the patient presents a symptom just like COVID-19, so you presume and treat them like COVID-19. And there's like 3 of them that I know, but the rest of them are positive. So any death that is COVID-19 that we don't know, they test all the people that are dying. And so far it's negative. There's room for missing? There's always room for missing, but it's not on purpose.
Right. But can we really hold up these negative results? Is there something with when you test these bodies? Because I know nothing about it, and it's just something we're trying to track down. Can we really hold up those negatives? Because we've seen false negatives in these cases, the probable cases where they get a negative, but then they're clinically diagnosed. So I'm saying the precedent is there.
Absolutely. That's why the funeral home is very careful and handles any type of dead body at this point for a funeral. They have to presume even if it's negative. So, but like I say, there's a chance that there's a false negative there. But we wouldn't know, like I say, is that's not intentional by anybody.
Right.
Just that it was negative.
Right.
Okay.
Mm-hmm. Okay.
So we keep our finger crossed that the census is continue to be low. Like I said, in the clinic wise, we kind of act like a pulse of the virus. So I can tell when we get busier. Because the people that come to the clinic and present the illness, or we don't see any. So we can feel it at the clinic level to see if this is trending downward or upward in the next few days.
Maybe people, though, are just because they're being told to stay home, they're just too scared to go into the clinic and get tested. I
would be scared. I would be like, I'm just going to hang on and try and beat this thing.
They call our hotline, on the big clinic, AMC, SDA, and FSP, we have a hotline to call in. And also, the public health also, they have their hotline. So we track by the number of phone calls, and people call in and leave a message to ask what to do if they're ill.
So are you guys seeing a lot of phone calls, or you're not?
Well, we see some phone calls, but not as much as before.
Okay.
Yeah, I can tell you that. Yes,
okay.
Not as much as before. So
because how it is, like, I have a lump, but I don't want to call. I don't want to go in because they're gonna tell me.
Doc, I don't want to ruin your vibe, but people they don't really like doctors. They're kind of scared of them.
I know, but like I say, they still are nervous and they still are scared about this COVID-19. So sometimes when they scare, they still can call in and like I say, if they call in, most likely if they have any symptom that we're concerned about, we just tell them to stay home.
Right. Yeah. And they need to call in.
Well, maybe that but when they hear that though, and they're like, if I call, they're just going to tell me to stay home. Why should I call? But we're just saying, guys out there. Mm-hmm. If you're feeling sick, call the clinic, okay? Call the clinic. Don't try and just hunker down and, put 5 blankets on yourself or whatever.
The most important thing is, Chris, is that hunker down and stay in your room. You know,
Stay in your room.
don't associate with your family members.
Now I got to do a new one. Stay in your room.
I did want to go back to the community testing. Is that free? Or are people going to have to pay for that?
For which
When we go out and we start testing,
Yeah,
you know,
we have people asking, is that
it's free. It's totally free. You know, what the advisory committee that we tell is that everything regarding COVID-19 testing should be free.
Mm-hmm.
You know, no one should be charged for it. You know,
that's how you market it.
Yeah, this is time where it's not to make profit. It's basically to try to isolate and identify these people to prevent the spreading of the virus, and it should be free for everybody. You know, all the insurance are paying, Medicare are paying, so no one should be charged at all. You know, nobody that comes, to the tier 2 clinic get charged for zero as they go in and out and complain of any type of COVID-19 symptom. You know, that's the service that provides to the community, and like I say, all testing are free.
There you go. Doc, anything else in closing that you'd like to add? What would be the single most important piece of information you could say to our listeners?
I think all the listeners, you know, again, you got to use masks everywhere you go. You got to wash your hands. You got to, social distance 6 feet. You know, if you go shopping somewhere for food, please go by yourself and not bring the family. Okay. And I know the roadblock is sometimes inconvenient, but it does help a whole lot and gets your life back to normal again. So we need to continue to do that even when the governor relaxed the restriction. Face mask and social distance is the big key to prevent the spreading or the recurrence of like the second wave of this virus. Okay?
Yeah, that's what something we're concerned about too. Is that we've seen it in other places that are fighting COVID. This it comes in waves.
Yes. So, but we can beat that. Everyone does. Everyone is a soldier in this one. So we have to abide by those rules. And again, even after this is over, I don't think the use of masks and social distance is going to be the abnormal. It's going to be the norm for a lot of people.
Doc, I was thinking last night, as I often do before I go to sleep, thinking back a couple years, when you see these tourists wearing the mask, and as a local, you're kind of like, what are they wearing the mask for? Now it's like they were onto something.
Yeah.
Yes, and they honor something. And like I say, after this one, I think that's going to be the norm for a lot of people.
I think so.
I know what I'm giving away for Christmas this year.
I think I look good with 50% of my face covered. It's a good look for me.
Yes, okay.
Okay. He's like, okay, where's this going?
Yeah.
Thank you, Doc.
You're welcome.
Okay,
Wash your hands.
Hey, guys.
Hang in there, Doc. Appreciate it. Okay.
Thank you.
All right.
Okay,
Bye.
bye-bye.
All right. There's Dr. Hoa from the American Medical Center. Yeah, thank you, Doc. Important advice there. Jason, yes, good morning.
Okay, so community testing is, of course, the big theme today. It's what everybody's talking about in our comment stream. And we did put up a poll. It's on